Looks like it's going to go.
I'm gonna just shove it.
Yeah, I think it is working. This meeting's being live streamed. All right, we're good to go. I think we are officially live on Facebook. So happy Monday, everybody. We were slightly concerned that we might not be able to do this. Obviously, the social media world has crashed. I thought it was the apocalypse. I was digging up food caches that I've had in my backyard for years and in a really big panic until it came back on. But lo and behold, who knows, just a glitch in the matrix. But we're here. It's Monday. Welcome back to Parents Helping Parents Live. Thanks for being here. You could be lots of different places right now, and you are choosing to be here with us. And that's really valuable. Hopefully something that is said tonight or communicated tonight will be helpful for you and your family. So if you're not familiar with Parents Helping Parents, we're a local 501c3 nonprofit here in Oklahoma City. And we've got one mission: caring parents, offering hope through resources, education, and shared experiences. So we're a group of primarily volunteers, parents, grandparents, and friends of someone any age that might be dealing with a substance use disorder. So welcome. If you've got a friend or a family member that's dealing with that, you have found yourself in the right spot. So I'm going to remind you to do a couple of things. This is Facebook. And one of the things we ask people to do is to share this live feed on your Facebook page. It's a really easy way to get the message out. It automatically puts this in front of people who may also have loved ones or family members or friends who are struggling with substance use disorder or co-occurring disorder. And like quite literally, and I don't think this is an overstatement, like sharing this on your wall, it could potentially save somebody's life and make a big difference for somebody. So go ahead and click share now, get that out there. So while you're here, we've only got one rule: what's said here stays here. So please feel free to ask questions. We don't point fingers, we don't judge, we just offer support. Many of us have had some of the same questions and some of the same experiences that you've had. Some of us have been able to find some answers, and we try to share our experiences and the things that we've learned on our own journeys and share some of the resources that we've uncovered along the way. So as an organization, Parents Helping Parents has no professional expertise. We've only walked in the shoes of a parent or a loved one, and our mission is limited to providing information, resources, and peer support. So this meeting, any outreach that Parents Helping Parents offers shouldn't be considered a substitute for professional counseling, legal advice, financial advice, medical services. We think all of those are wonderful things, and if you need them and that's appropriate for you, we want you to get those. We just don't offer those. We're kind of the middleman. We want to connect you to those services, and we want to share our experience. So we're really pumped that people come in and they watch our live stream, but we really want people to remember that we also have chapters that meet in person and on Zoom, potentially in your local area: Oklahoma City, Edmond, Wichita, Tulsa, Norman. And Parents Helping Parents live stream is great, but there's really no substitution for being in a room with people who are offering support and caring for you. And so if you're interested in those, or for more information about those, go check out our website at parentshelpingparents.info, not at, that's a social media thing. You can tell how I spend most of my time. www.parentshelpingparents.info, and you can find all the information about our chapters and upcoming events and all of that stuff. So during tonight's meeting, you can ask questions and interact with us a couple of different ways. You can do that live on the Facebook feed in the comment section. I will be watching that and kind of keeping an eye on that for people that might have questions or might need additional information. Or you can text our live text line that I will be monitoring. That number is in the title of the video on Facebook, but it's also 413-384-9244. But like I said, it's right there in the title of the video, so you can find it there. If you want to be on our undisclosed email list, shoot us a comment on Facebook or send us your email address in a private message. At Parents Helping Parents Inc. is our Facebook page if you're finding this on somebody else's wall. We don't send out a bunch of spam. It's just a quarterly newsletter and meeting updates and things like that. So let's see what else. I feel like I'm missing something. I'm kind of scrolling back through my notes. I don't think I'm missing anything. It's definitely Monday. we're here. I'm excited. I'm actually really excited about the meeting that we've got tonight. The speaker that we're bringing in, Mary Ann Badenoch. I think I got that right, Mary Ann. That was only my first time pronouncing it out loud, so I did it. Mary Ann is from the Partnership to End Addiction, and she has got a lot of really great information about co-occurring disorders, and is just a resource with a plethora of knowledge about being a parent, what to do if you've got a son or a daughter that's struggling with substance use disorder. So I'm really excited to hear what she has to say. I'm going to let her introduce herself, and we're going to get rolling. But if you haven't yet, click the share button, put this on your feed, and let's get rolling. Mary Ann, the floor is all yours. I'm going to turn off my camera so that nobody sees my ugly mug, and looking
Thank
forward
you,
to hearing what
Derek.
you've got for us.
You're welcome to stay on. Thank you. Thank you, Derek. And thanks everyone for being here. I'm looking forward to spending this hour with you together. And as Derek mentioned, I'm Mary Ann Badenoch. I'm a licensed professional counselor, and I also specialize in addiction, both substance, and I also have done training in gambling. I have a small private practice, and but primarily what I do is I work for the Partnership to End Addiction, and the Partnership is a nonprofit. We've been around for a long time. We work with parents of teen and adult children who are struggling with substance use issues, and oftentimes there are also co-occurring disorders. It's a terrific organization. I've been there for since 2017, helping them start their digital helpline. And then I moved on to starting to create online support community groups. And those online support community groups have grown quite a bit, especially over the pandemic. And we have our coaches who are trained volunteer peer parents who have also been on this journey facilitate these meetings, and they are just a terrific group of people. I want to give them a shout out. I'm here tonight because one of them asked me to do this. He's also involved in this community as well as being a coach for the Partnership to End Addiction, and I am so happy to help and give back whenever I can. So welcome, and I'm just going to get started by screen sharing a PowerPoint presentation that we'll move through. And, you know, I'll have to say that this topic is always requested because it is such a complicated topic when we talk about co-occurring disorders. And interestingly, somebody asked me about this recently, you know, what are co-occurring disorders, or what is the difference when I see a dual diagnosis and then I see co-occurring? And, you know, I've looked it up sometimes, and there are treatment facilities that actually do suggest that there is a difference between them, but quite frankly, there's not. It's really just a different way of expressing the same thing. So if you'll see a co-occurring disorder, you'll see somebody call it dual diagnosis. Also, it's comorbid has been used as a way to identify a person that has both a substance use disorder and a mental health disorder at the same time. And so when we're talking about adolescents and young adult, that's the population that we work with at the Partnership. By the way, when I say young adult, our age keeps getting bumped up. We have parents that come into our meetings or come for help at the Partnership that have adult children that can be in their 40s or even 50s. So that age really there's a lot of latitude with how old a child might be when a parent is coming for help. But if you look here, you'll see that adolescents and young adults with mental health disorder, also having a co-occurring substance use disorder, there's between 30 and 45% of those young adults that have a mental health disorder who also have a substance use disorder. And the other interesting statistic is to look at that youth with a substance use disorder also having a co-occurring disorder, which is mental health disorder, 65% or more of young adults or adult children that have a substance use disorder also have a mental health disorder. So a lot of times there is an underlying mental health issue that is driving the substance use issue. And so, why is it important to recognize co-occurring disorders? Well, if left untreated, it is one of the leading indicators for a person to become suicidal or to exhibit behaviors of self-harm. Mental health disorders oftentimes do lead to people trying to self-medicate to feel better because they just are so uncomfortable. And the thing that's tricky about co-occurring disorders is that the symptoms of substance misuse and mental health disorders often mimic each other, and that's why it's hard to diagnose this sometimes. So just kind of looking at family history and saying, what if I'm looking at this child or my child, what should I think about when I wonder whether or not they have a mental health or underlying mental health issue? And there are risk factors that are involved in the family. And so this little chart shows that, if you have a first degree relative, which are parents and siblings that have these disorders, and they're not all inclusive, but there are some of the more prominent disorders. What is the increased likelihood that a child would develop a disorder? And so with major depression, it's 1.5 to 3 times more likely that a child born of a parent or first degree relative, parents, siblings, would also have a tendency to develop that disorder. And as you see, as we're kind of clicking down this list, with schizophrenia, that's about 10 times more likely for a child to develop schizophrenia if a first degree relative also has that disorder. So when I'm working with people, I always want to find out about family history. It's really important to understand it, to know about it. It's a parent's responsibility, I think, to not only know what their family history is, but also to talk with their children about it. Because the one thing that's really difficult when a person is having symptoms and they don't know what it is, it makes it scarier. So for a person to understand what's in a family, sometimes it can help them connect the dots a little faster when they're also having symptoms. And so, what impacts how the brain works? So we've got the risk factors that are genetically linked. So certainly there are many factors that cause changes actually in gene expression, and that really can alter the way the brain works. So when we're looking at some of those, we're looking at, chronic stress. We're really looking at the family growing up in a certain environment, a certain family environment where there might be chronic stress, when there's been trauma, or abuse or neglect, where there's been drug exposure during pregnancy or even while growing up in a household where there are people that are substance users. And then we have other adverse childhood experiences. And oftentimes that can be anything from growing up with severe financial stress, or poverty, or being in an area where there aren't medical facilities or treatment available, being in a family that is just detached from each other, parents going through a divorce, going through a major loss during childhood. All of those are considered to be adverse childhood experiences. And so when you're looking at kind of the likelihood of a person developing a underlying mental health issue, oftentimes it's also looking at what kind of really getting the big picture of what's happening in their lives and what's happened in the family or in their community. And so how important is age? Well, substance use typically starts around the age of 13 or 14. Certainly, there are some people that start sooner, some later, but that's usually when some of the signs of mental health issues commonly start appearing. And certainly if a child has an underlying mental health issue, it does increase the risk of later drug use or the development of a substance use disorder. And so sometimes people will say, I don't know. I don't know if they have this problem because they've been using, and I don't know if it's the drugs. I don't know what it is. So I kind of, you'll see a family album here of some photos. And so what I usually ask people to do is look for the clues, be a detective. So we certainly want to talk about, what do you know about your family, whether it's a first degree relative, or even if it's a grandparent or an uncle or an aunt, what is the family history of substance use or other mental health disorders? That's one clue to determine whether or not a child has those issues. Behavioral or emotional problems as a child or adolescent, I usually like to find out if when they can first remember when their child was exhibiting those issues. What was the child like at age 3, age 4, age 7, certain touch points of their youth. What were you noticing then? Were some of those mental health issues presenting at that time versus when they started using substances? So we definitely also want to look at if a person has been using substances for a long time, if they have been through treatment and they had periods of abstinence, have the symptoms persisted during the time of abstinence and actually, or decreased use, and actually is that one of the triggers that caused them to relapse? And then also, of course, prior psychiatric treatment that appear to be independent of substance use. So again, it's not an easy thing sometimes to really pinpoint if and when the underlying mental health issue began. So again, how is a co-occurring disorder diagnosed? Well, providers do tend to diagnose based on their own areas of expertise. That does happen. And this is an example here. This person named Carl presents with being restlessness, agitation, anxiety. If Carl goes to a person that specializes in mental health, but really hasn't had any training in substance use issues, they might suspect that Carl's having a manic episode or an anxiety disorder. They'll be diagnosing based on their background in mental health versus somebody that may have just training in substance use primarily, might suspect that Carl could be intoxicated with a stimulant, cocaine, amphetamines, or maybe they're actively going through a sedative withdrawal. So effective treatment for co-occurring disorders, it does require a very thorough evaluation for both underlying mental health issue and substance use issues. So there's two diagnoses. So mental health disorders can mimic the effects of substance use and vice versa. That's why this makes it so complicated. So I'm going to just kind of rattle off what psychiatric symptoms can look like when a person is under the influence, right? Intoxicated. So with alcohol, they're going to be overly aggressive, potentially, aggression, overly sexual, aggression, mood swings, poor judgment, poor attention. If it's stimulant intoxication, there's a lot of anxiety. There may be anger, restlessness. There's that restlessness again. Cannabis, we'll see excitement, anxiety, sensation of slowed time, poor judgment, social withdrawal. Hallucinogens, we'll see anxiety, depression, paranoia, hallucinations, fear. And the opioids, there'll be excitement or apathy, depression, poor concentration. So these are all the things that a patient would exhibit under intoxication. So then we'll take a look at the other scenario, which is what do psychiatric symptoms look like when a person's in withdrawal from certain substances? So here we have alcohol, sleeplessness, anxiety, physical restlessness. I'm going to say irritability. You see that a lot. Stimulants, low energy, depression, can't get out of bed, irritability, poor concentration, insomnia, increased appetite, cannabis, irritability, anger, aggression, anxiety, restlessness, depressed mood, opioids, sleeplessness, feelings of dissatisfaction, restlessness, a lot of body aches, irritability, anxiety, and with tobacco. And again, I always ask, because if parents are watching this tonight thinking about your child or thinking about if you've ever tried to stop using something and how you've experienced some withdrawal symptoms, if you've tried to, or if you've quit smoking, you'll probably identify with the irritability, the frustration, the anger, anxiety, poor concentration, increased appetite, restlessness, depressed mood, sleeplessness. And actually, may I add there too, if you're really thinking about what that looks like, sometimes when people take themselves off sugar, a lot of people try to take themselves off sugar, they will also have withdrawal symptoms that are very similar to some of the descriptions that you see here. So intermission time, when we're treating people for co-occurring disorder, where there's a substance use disorder and there's also a mental health issue, even if it's just the mental health issue, there's no such thing as the magic pill. Yes, it's true that medications do help calibrate the brain, which is important. If the brain's not calibrated, all the therapy in the world, it will be hard to get through to a person. So one of the more important things is to help a patient get their brain calibrated so that they can receive some interventions, some treatment interventions to help them learn coping skills and help them and help them cope better in life. And so, when we're talking about finding the right treatment program, it's hard. One of the recommendations that we had is to go to samhsa.gov, and you can plug in, you can check off for looking for a co-occurring or dual disorder program and be able to find treatment in your area using that treatment finder. What's tough with treatment programs is that oftentimes they will state that they're dual diagnosis or they treat co-occurring disorders, and that may not be necessarily true. Sometimes what I'll find is that they treat substance primarily and some mental health. And really, when you're looking for a program for treating a co-occurring disorder, you really want to find clinical staff that's trained in both assessing and treating and providing medication to assist treatment for both mental health and substance use disorders. So it's really important that those are both equally weighted in a program. So the treatment would be integrated for both disorders. So they might have a group that might be dealing with substance use issues. They're also having a group dealing with mental health issues. What's just so important, and of course, we are the Partnership to End Addiction, and we are working with loved ones, mostly parents and caregivers of and adult children. Family involvement is so vital, especially with the complexities of a co-occurring disorder. And there is a lot that family members can do as well. So wants to say that this is true for people in general, and that is that when their parents or their families involved, they do better. And a lot of them will say, if it wasn't for my family members not giving up on me, I don't think I would have gotten into recovery. So it really is that important of a relationship. Support groups out there for people that do have a co-occurring disorder are NAMI. These are I forget the name of this now. Sorry about that. It's GBSA. I don't know why. I'm just blanking on that right now. But it's for bipolar people that have bipolar mood disorders, and CHAD is for attentional deficit. So it's important that not only going to treatment support groups like a 12-step program or Smart Recovery, but also going to support groups that attend to mental health issues. There are some meetings that actually are dual diagnosis 12-step meetings. So there are some meetings that actually are for people with a dual diagnosis out there. It's not like they're that ample, but they are out there. And also, with the treatment program, people with underlying mental health issues and substance use, you typically have more touch points with life skill issues, with legal issues. So a lot of times there is really a higher need for help with housing, work, school, training, transportation, and etc. So there's just more kind of lifestyle intervention needs too. And so one of the most important thing is to find a provider that is well-versed in mental health and substance use issues. Because clearly, if somebody's not, and they prescribe somebody something that will become addictive for them, that's not a good thing, and that's happened. So you really do want to find a psychiatrist or a provider that does understand substance use issues and addiction issues, as well as treating mental health. And that is available to meet regularly to keep close track on progress. With medications, it's tricky business because especially for young adults and adult children, there's a lot of resistance to going on something. And there's a lot of patience that's required. The rule of thumb is that you start low and slow because you want to see how somebody's responding to the very lowest dose. And then if they're doing okay, you're going to slowly start titrating them up over a period of time to see where their therapeutic level will be. And that can take weeks or to months to really get to a point where they're really benefiting from the therapeutic value of what they're taking. And there are side effects, typically dry mouth, fatigue. Most of the time people will talk about dry mouth or fatigue. With some of the antipsychotics and others, weight gain is a side effect that could be problematic. A lower sex drive or ED can be an issue with antidepressants oftentimes. The other thing is, taking the medication as prescribed is so important. And that's where oftentimes I'll talk about the family member being a team. And so they're really working together with the patient to make sure they're staying on schedule and taking as prescribed. And so with medications, it is a science, certainly, but it's also an art. I know we're getting a little bit better with pinpointing that this particular one would work better with your chemistry over there and this one here, but we're really not there quite yet. Oftentimes, we're going to try something that we think will work, and if it doesn't, sometimes we have to try something else. So it's kind of an art and a science, depending on a person's metabolism, their chemistry, etc. And so there are medications that we want to be very careful with, especially if there is a history of substance use. And even if it's not with the individual, if you're bringing somebody for an evaluation that does not have a substance use issue, right? But there is substance use issues in the family, it's very important to let the prescriber know that, because what you don't know is whether or not something that they start taking could flip that switch into something that could become addictive. So these are some of the ones that you're seeing here, things that can be abused or misused, such as benzos like Xanax, Klonopin, Ativan, and Valium. ADHD drugs, now some people don't abuse them, some people do. They also can be sold, so they can be misused in a lot of ways. Sleep products like Ambien or Lunesta, and opioids also. And again, sometimes, post-surgery and that kind of thing, people will be prescribed. Always recommend that somebody is managing the prescription. And so what does successful treatment look like when you finally do get your loved one into treatment and they're engaged in a program? Well, first of all, it's really, with the providers working with the patient, with your loved one and you, determining when that person is stable. And stable meaning well enough into recovery and also stabilized with any mental health issues. The brain is calibrated again. And it's really important that the individual receiving the treatment does believe it's useful. That's certainly an indicator that they're going to continue with a recovery plan versus dropping it the minute they're out of treatment. And also, while they're in treatment, it's really the ability for the individual to understand their co-occurring disorders, understand their mental health issue and what are the key elements of that, understand the substance use issue and what the key element is of that disorder. And then also really identifying and understanding their triggers. for relapse. What would be a trigger for me? What are my patterns for relapse? What are my patterns for triggers? And then how do I avoid them? And if I do find myself triggered, how do I deal with it? And so a structured routine, I think this is just important for about anybody, but especially for people with underlying mental health issue. Structured routine is really important. Regular bedtime, regular eating times. So when we talk about it's not about the magic pill, a lot of that has to do with it's a lifestyle that somebody works towards adapting, and it's a healthy lifestyle that will help keep them balanced along with the medication. But it is, gets down to the basics again. It gets down to eating properly, good eating, good eating patterns, healthy foods, and also good sleeping patterns and exercise. For a lot of people, the exercise really helps keep them balanced. Getting enough sun every day, and also having social outlets, and having, for a lot of people, work, because that gives them meaning and purpose in their lives. And that's really very, very important to sustain recovery. So when we talk about daily recovery activities, the things I just talked about now are examples of what that would look like. And also, though, during a treatment program, they're going to be talking about a coping plan. What happens when I find myself in this situation or that situation, something that they know will highly trigger them to want to use or to want to stop taking their medication. What would that look like? And then what is their plan for how they're going to deal with it? Planning is what it's all about. It's very often, if somebody hasn't planned for what they're going to do, it is very difficult to almost impossible to plan something on the fly. And also using social support. So it's family, it's community, other people in recovery, therapists, psychiatrists, coaches, using personal coaches, and all that, to be able to support continued recovery. So these are typical relapse thinking patterns. And if you had a child that has been in recovery and then is not in recovery with a co-occurring disorder, you might have heard this before. I know I worked at a hospital for a number of years, and I heard this a lot when they've come back into the hospital after an episode, or because they made a decision to stop taking their medication. So we'll hear, I was feeling better, so I thought it was okay to stop taking it. I'm all better now. So I don't need it anymore, right? Hear that? I really didn't think I was that sick. It was just a passing problem. I'll hear that a lot with young people, because it's their first experience with it perhaps, or they think maybe it is just a passing phase and they've grown up a little bit more now. So, they don't really want to be sick. So, for them, they might say, well, with maturity, I've grown out of it. A lot of people will say the meds make me feel bad. And so, the Adderall made me feel so much better, and it's not that it's not true what they're saying, because there are medications. When people take certain medications, some people don't feel good on certain medications. So that's a really good, again, it's a good clue that there might be something about the medications that really weren't working for that individual. And it really does mean a close relationship with the prescriber to kind of figure out what it is that would work better for them based on what they're experiencing on a medication. I don't really hear this too often, but nobody appreciated the effort I was making. A lot of people do like to have people notice that they are working hard. And sometimes family members just feel like they're finally doing what they're supposed to do, and they don't recognize that. But it's always important to recognize and provide positive reinforcement for people when they are doing the right thing. That will encourage more of the right thing and less of the thing you don't want to see. So it does make sense to offer positive reinforcement whenever you can. I don't like taking pills. I want something natural. I heard this 9 out of 10 times when I was talking with young adults in groups. And the natural thing for them oftentimes would be smoking pot. I feel better. I'll just smoke pot. I don't want to take those pills. And then we would have to go into a whole talk about what that looks like. And then I took it for a couple of days and it didn't help, it doesn't work. So the idea that the provider really needs to sit down with a person and give them the appropriate expectation for how long it's going to take, what are some of the things they might feel, what's normal, and then what they need to report if they're having symptoms. I usually would say that a good thing to do when somebody's starting on a medication is for them to start just a little journal. It could just be bullet points every day about kind of how they're feeling today, any symptoms that they're having. Are they feeling better, worse? It's really good to track those things when they're going for a visit to the psychiatrist. It's easy to forget when you get in front of the psychiatrist for your hot 15 minutes how you've been doing. So it's better to make some daily notes so that you can see any patterns that might be developing, or patterns of symptoms, or patterns that suggest that you're making progress from one week to the next. And so what can go wrong with treatment? It's not one size fits all, depending on the nature of the co-occurring disorder. And I've seen this in groups quite a bit, where the standard protocol for treatment for addiction is, you also need to go to 90 meetings in 90 days. And here's Harry, who also has schizophrenia. And for Harry to walk into your AA meeting or your NA meeting and sit down in that meeting and participate while he's still stabilizing from schizophrenia, is just about impossible for a lot of people. I work with people that are on the spectrum, oftentimes too, from Asperger's to autism, and I can tell you that it's just as hard for them to be in AA meetings sometimes because they process a little bit differently and they don't relate as much to some of the more abstract, abstract concepts of AA. Oftentimes, they find it more helpful to relate to more behavioral type of activities for change. So here's another one. Sabrina's in treatment for bulimia, and her treatment team views her co-occurring disorder, right, which is amphetamine use, as part of her eating disorder, instead of it being a co-occurring amphetamine use disorder. So the distinguished part here is that she's bulimic, but she's also taking amphetamines. But for her, it's not part of her eating disorder. It's something that she's doing, which maybe it's treating depression for her. Maybe it's helping her with debilitating depression, but it has nothing to do with her eating disorder. So you can see how tricky it is when a person's getting treated with comorbid or co-occurring disorders. And here's Ricardo, who has a co-occurring polysubstance and major depressive disorder. He's being denied medication by a psychiatrist until he returns, having been abstinent for 30 days. And that happens with some frequency when a person is hospitalized. Psychiatrists, it's very hard to know what's going on with somebody in a couple of days. And oftentimes they really won't automatically put them on something to treat their underlying mental health issues until they kind of see what happens once they've fully withdrawn from the substances. So that's really important to know, because if a family member can state that they know that Ricardo's parents say, to the psychiatrist, hey, I know Ricardo has been majorly depressed since he's been a preteen. This is before Ricardo started using polysubstances. That's a very important piece of information for a psychiatrist that might be able to evaluate and say that, okay, based on Ricardo's history, I would start treating him for underlying depression based on, the parents' input or Ricardo's acknowledging his own depression. And so family support, as I said before, is so important. So important to encourage treatment, to keep that door open for when a person is ready, to provide emotional support, to provide the encouragement, to participate in education on what this is, how it's treated, what recovery looks like, to attend individual and family counseling, to assist with medication, to help an individual that needs help with structure and routine and social supports. Most people need somebody that's there, walking alongside them. That's the way I like to look at it, is kind of you're walking alongside them, to just help support them while they're taking these steps. Attending family support group meetings, certainly, and knowing relapse signs, really important, to be able to acknowledge and to let your loved one know when you're noticing things that are signs of relapse for them, if they may not be noticing it themselves. And so when we talk with parents about the long haul with co-occurring disorders, it's a particularly long haul. It's particularly exhausting. It's particularly scary at times. Life really, it can be a roller coaster ride for parents dealing with a child with a co-occurring disorder. And so at the Partnership to End Addiction, we do have several programs that parents plug into. We have a helpline that parents get involved with, to call our helpline specialists, who are master level specialists, and they work with parents to help locate treatment programs and to provide resources and guidance. We also have parent coaches who have also been there and work with our parents one-on-one for a period of 6 sessions, to just really have somebody to listen to them, to validate, and to understand what they're going through because they've been through it themselves. And then we have our online support community. And that's where, again, in all these different types of programs that we offer at the partnership, we teach primarily a technique called CRAFT. CRAFT is Community Reinforcement and Family Training. And it's a communication and behavioral skills program that really is to help build better conversation, better communication, to help motivate and encourage a child for treatment. CRAFT also really heavily focuses on self-care. It's really for the parent to build their own resilience by maintaining, something like a regular lifestyle, even though they're going through all of this. So meaningful daily routines, making sure they're maintaining hobbies and other social supports, and mainly, most parents that come in, they don't want to focus on self-care. They want to focus on, getting their kid better, and then they'll focus on themselves. The only problem is they're not bringing their best selves all the time to the problem. So by focusing on themselves and helping themselves kind of come to the issue in a calmer sort of way, it ends up really making it a much more positive experience when they're trying to communicate with their loved one, with their child. So I do have some information here about CRAFT, and you also will get some information, I think, in the chat if you wanted to reach out for some help. By the way, the help of the partnership is free for you. We are a nonprofit, and so our funding comes from government resources, from private resources, from corporate resources. And it's a terrific program. I really am very proud of it. We have some really dedicated volunteers and dedicated staff for this work with parents. And I just hear so often how much of a difference this has made in the lives of the parents that come to us. And so I'm going to just put up these resources. Maybe what I can do is actually copy and paste them into the chat. And these are actually some of the guides that I spoke from. These are the guides that you can find on our website. And those are really comprehensive, picking through the different types of mental health disorders and what that looks like. So I think in the co-occurring disorders workbook, I've used that for years, has great worksheets to help people develop their treatment plan and stick with a treatment plan. It's kind of a daily journaling kind of thing. It's really good. I've used it a lot, so I wanted to offer that to you too. And actually, here's my email address. So I know I'll be taking some questions. for the next 15 minutes. And, feel free to email me, please, if you have any questions that didn't get answered or think of something afterwards. I'm happy to respond back to you. And I'm just going to go ahead and put that paste this in the chat. I think I just did that. There we go. Okay. Well, hi, Derek.
Yeah, excellent. Hey, thank you so much. So I'm gonna, while these are in the chat, I'm gonna
Should I
copy
take
and
can I take my screen down now? Would you like me to do that?
yeah, you can take it down. I'm
Okay.
gonna put these over into the live Facebook feed so that people can click directly on those from the Facebook page. Let's see, 1, 2. So there's also links to the support link and just the general website to the partnership there as well. So, Mary Ann, I've got 2 questions that I'd like to run by you and get a little bit of feedback on from you. One is we often get asked, my child has so many problems. They've got mental health issues, they've got substance abuse issues. Where do we start, and which one of those do we try to get a handle on first?
That's a good question, because actually both are the priority. The issue with that comorbidity is, if we're talking about, I've got a child with an underlying mental health issue that's not being treated or maybe not even being diagnosed, and then I've got a child that same child's also using substances. Now, the issue with that is, it's kind of two-pronged. We need to help squeeze out the use of the substance use. And some psychiatrists will work with people on that, on dialing up on something that's going to help them feel a little better while they're titrating down on substance use. Because they're not just going to drop, most people will not just drop substance use if they're going to feel bad. So they really need, again, it's the combination of coming kind of titrating down on the substances and then titrating up on something that's going to help them feel better. Because if they don't feel better, they're going to go back to using. So yeah, I don't know if I answered your question in terms of priority.
Yeah, I mean, I think that's a great answer, because I think that, one thing the general public, I think, gets confused about when they hear co-occurring disorders is they don't really understand the full investment of how those things are intertwined, and they think, oh, I'll start with one and then I'll do the other, or vice versa.
Yeah.
So I just kind of wanted you to address that, and I think you did beautifully. So I noticed you talking about specifically the thing that kind of spoke to me is when you were talking about how difficult it might be for somebody with certain mental health disorders or behavioral health disorders to attend AA meetings and do some of the things that are very traditional. And what I took away from that is that treatment for people with co-occurring disorders is going to look vastly different depending on the individual's needs. How do families begin to navigate what treatment is best for their loved one?
Yeah, and I really think that does involve a treatment provider. It involves a professional that understands the disorder and how a person would relate to changes. I'll give you an example, and this is actually early in my career. I worked with a young man who was on the spectrum and had a marijuana use disorder, and he was supposed to go to NA meetings, and I was working with him and trying to do some cognitive behavioral therapy with him. And what I recognized is that he just wasn't connecting to those kind of abstract notion of, changing his thinking in this kind of abstract way. And so it was really just finding out what worked for him, that I understood that he really related to more behavioral types of changes. So a person that's astute with certain types of disorders knows that this person's a more literal thinker. They're going to work better if we're doing something with behavioral changes in order to be able to reduce or extinguish substance use issues and also to attend to mental health. And then, I think that the main thing is that parents certainly can do a lot. You can do a lot of your own research. You can find out a lot of good tricks of what you can do to help your loved one. But I think working with a professional is super important, so that, that they're going to be led to the best help for their unique needs.
Yeah, thank you so much. So one of the questions that I ask everybody that comes on, just because I love the variety of different feedback I get, is if you had 60 seconds, 2 minutes to deliver like kind of a single thread message to a family who might be struggling, or a family that's got a son or a daughter that's struggling with substance use or co-parent disorder, what would that 1 to 2 minute message be for that family?
I think the message would be that you need to take care of yourself first. And what I mean is that a lot of people that are struggling with substance use issues with their child or loved one, or even underlying mental health issues, really feel a lot of shame, and they feel stigmatized, and they feel very alone. And so I know with most people, when they finally start feeling better is when they start getting connected with other people that are also experiencing the same thing. I see that all the time, actually, with the online support community. So the idea is to get connected with other people who understand what you're experiencing, to know you're not alone. I think that is the most important start point, because it really is a trickle down kind of effect, especially with a parent and child. So if the parent can kind of get a handle on this, get more comfortable talking about it, start relaxing a little bit enough to start learning and educating themselves and getting the support, they're already going to be a better help for their child.
Yeah, man, excellent. Thank you so much. Mary Ann, thank you just for your time tonight. Thank you for being with us, for the work that you do with the partnership. If people didn't hear this, I want to make it like super clear for them. I know several people who are parent coaches for the partnership. I know lots of people in the Oklahoma City area who have been through the program and been a coachee and have received help. And if you're a parent out there that needs some support, free, valuable, experienced support, it's right there. It's available through the partnership. Click on the link and connect with them. There's no reason why you shouldn't do it if you're a parent who's got a son or a daughter that's struggling. It's a great first step in trying to find help and begin to navigate some of these difficult questions that are coming up even today. So thank you everybody for joining us. You've got 1,000 different things you could do on a Monday night, including Monday Night Football during football season, but you're here, you're hanging out with us and not watching the Cowboys lose. I don't even know if they're playing tonight. I just wanted to poke fun at my Cowboy fans. So Mary Ann, thank you so much. I really appreciate it.
Thank you,
It was
Derek.
such a pleasure.
Thank you so much. I appreciate being here. I appreciate you.
All right, everybody have a great couple of weeks. We'll see you in 2 weeks for the next live stream.
Thank you.